We are here with Dr. Kojo Sarfo, and Kojo, appreciate you for making the time to speak with us.
Having me.
Definitely. So we just wanted to meet with you, talk with you, get to know you a little bit more, get to show our following who you are, your accomplishment, talk about your brand new book that just launched.
Yes, sir.
Definitely gonna dive deep into that. But just get to start off. How are you doing? How's your day going?
I'm doing fine. It's the holiday season. I got to spend some time with family, and now I'm right back to the crazy life that I live. So I'm thankful to be here, and I'm excited to talk about my book at any moment. So thank you once again for the platform to talk about the book and the stuff that I'm doing.
Definitely. So, speaking of your book, we're going to dive into it without giving away too much.
Right.
Of course, we want to entice them to check it out. So, the book you've already won. For those who haven't read it yet, what attracted you to this career of mental health? What brought you to mental health?
Well, I feel like I got into the mental health space kind of sort of by accident. My father recommended that I move to Augusta, Georgia, and apply at the local psych hospital there. And that hospital was offering to pay for me to go back to school because I had my associate's degree at the time and I wanted to get my bachelor's. So the fact that that hospital was partnered up with the local university and they could pay back some money and help me go back to school. That was the thing that got me to go into mental health. But it didn't necessarily keep me there. Once I got into that environment and I saw the similarities between the patients and, us people, the workers, I hate to say normal because what really is normal, but once I saw how similar I was to the patients, I actually developed a love for working within that environment. And I figured out rather quickly that I wouldn't want to work anywhere else.
Cool. And so you're a psychiatric mental health nurse practitioner,
Yes, sir.
right? So what would you say are your main responsibilities working in that role?
Okay, that's a very good question. That's a fantastic question. A lot of people are not familiar with what the role of a psychiatric mental health nurse practitioner is. A lot of people get us confused with social workers and therapists and psychiatrists. I would say that our job description is very similar to that of the psychiatrist. So psychiatrists go to medical school, then they go through residency, and then they're practicing as an attending psychiatrist. And for a psychiatric mental health nurse practitioner, our backgrounds are a little bit different from that of the psychiatrist. We go through nursing school, and then after that, we go through additional education to get that advanced practice registered nurse certification. So some of us have master's degrees. You need at least a master's degree to practice as a psychiatric nurse practitioner. But my program was a DNP, a doctorate program, so I had to go an extra year. But our day-to-day, we admit patients, we discharge patients, we do comprehensive psychiatric assessments, we prescribe medications. So we do a lot of things. I would say that our job description is very identical to that of a psychiatrist. Now, depending on the state that you practice, it can get a little bit dicey because, like my home state of Georgia, nurse practitioners, the whole nurse practitioner umbrella, which includes the psychiatric mental health nurse practitioners, the scope of practice is restricted. So within the state of Georgia, you cannot prescribe Schedule II substances without the oversight of a physician. You have to work with the physician. Some states like Maryland and Arizona, do allow nurse practitioners to practice independently. In the state that I'm practicing in now, currently Virginia, a nurse practitioner can practice independently after getting 5 years of experience with a physician. So the background is a little bit different, but the actual day-to-day, we do very similar things: prescribe medications, admit, discharge, do comprehensive psychiatric evaluation. So that's my long-winded answer to your simple question.
Right. So this is something that's intense and like you said, that was a long-winded answer. And
Right.
this is something that you said you got into on accident. So I'd imagine that there's something that you know now that you didn't know when you started off that might have helped you. Like, is there anything you could think of that you kind of wish somebody told you when you first started pursuing this field?
Yeah, I wish somebody told me the importance of self-care, because when you work in this environment, your day to day, your 9 to 5 consists of you being a firefighter. I like to describe myself as a firefighter because every day I'm putting out the fire. Patients are coming to me with issues. Patients are hearing voices. Some are having suicidal thoughts. A lot of patients are, having a lot of mood irritability. Like mood swings up and down. People are going through a lot. So your day to day, like you're a firefighter, your job is to come to work and put out these fires and take care of these problems. And that's essentially what I do. So I wish I had been told that working in this field, you have to take, extra steps to take better care of yourself, because sometimes like we get on the road in our personal lives and we're doing so much and we're not sleeping and we're not taking care of ourselves. So it doesn't help when you come back to work and then you have to take care of patients, and essentially you're taking on all of their trauma and trying to process it and help them out. So when you work in this environment, self-care is a priority, and you shouldn't be afraid to say no to certain things that you think are obligations, but you have to put yourself first.
Wow, that's deep. And I like how you said you're a firefighter. During the holiday season, do those fires burn a little hotter? Do you see things really start to pick up with the people that you're working with around, such a with the most wonderful time of the year on one end,
Right.
but on the other end, it could be a tough time for a lot of people.
Right. No, I completely agree. It is the most wonderful time of the year, quote unquote. That's what we say. But for a lot of, the people that I take care of, PTSD is something that a lot of the patients I serve, struggle with. So a lot of times the nature of their trauma can, be directly correlated to maybe past events such as losing a loved one, or maybe they, have been assaulted, raped, physical abuse, domestic violence. And a lot of times those feelings intensify throughout the holiday season because, it's getting darker much earlier now than it is in the summer. And a lot of people are spending time with their loved ones, and everybody around you is happy. So it makes it more obvious that you're not happy and that you're going through a lot. So I definitely see it with my patients. And sometimes, I'm not so quick to just throw medication at them, but you just have to hear them out and just listen to them, because a lot of times they want somebody to hear them out, because everybody wants to feel heard, and especially people who are hospitalized, because I work in an inpatient setting, so these people don't get to see their family members as often as we do, because like they're hospitalized in the actual state hospital, so people have to come and visit them. So just being a listening ear and just taking the time out to listen to somebody for 10 to 15 minutes goes a long way.
Awesome. And this is obviously a very, tough industry to work in, but what is some of the things that are like very rewarding about your job that clearly something makes you keep going, clearly something makes
Right.
you investing in something. So what are some of those things? Like what are some of those feelings that you have experienced that make you want to do this?
Right. I like, I think, within the field of psychiatry, it's so diverse. It's not just depression, anxiety. You have, like I said, PTSD. You have people who are dealing with past trauma. You have people who are actively hearing voices, and people who are chronically suicidal, people who just every day don't want to live. So there's so many different parts of psychiatry. My favorite part is actually people who come in acutely psychotic. So these are people who are hearing voices, seeing things, not taking care of themselves. And I get a kick out of seeing somebody coming in and they're not sure where they're at. They can't organize their thoughts. And then we come in as a hospital staff. We listen to them first and foremost. Then we get them on the appropriate medication, make the correct diagnosis, and then right before they're getting ready to go back out, you see them. They're able to have a coherent conversation with you, and then you think back like, oh wow, 2 weeks ago this person wasn't able to formulate any kind of coherent thought, and now they're doing so much better. They're ready to get their life back on track. So seeing that transition is what keeps me going.
Wow. And so doing all these things, working the space that you work in, I feel like you have to be a certain type of person to want to do this one, and then to excel in this. So like what is like a quality of an individual that for you or for other peers in the industry that you see that you're like, wow, we're excelling, what qualities do you guys share that make you guys successful in doing what you do?
Well, it's the first quality I can think of is empathy, because you have to be able to put yourself in these people's shoes. And I mean, there's so many different ways that you can uh, be diagnosed with a severe mental illness, such as, schizophrenia, schizoaffective disorder, bipolar, and things of that nature. And a lot of people don't know that you can hit your head, you can bump your head one day and have a traumatic brain injury, and that can change your whole thought process. That can manifest into you having acute psychotic symptoms. You can start to hear voices yourself. So when I think about the fact that, oh, it could be anybody, it makes me more empathetic, and it makes me less judgmental of the people that I take care of, because like I understand that anybody can, like run into hard times, or you might be working and functional one day, and then the next week, you could have something life changing happen. So just being very empathetic, and that helps me be, just a more grateful person. So nobody's life is perfect, but when I see how rough it can get, it makes me more thankful for what I have. And that's another reason why I do what I do as well.
Okay, so shifting gears a little bit, you've dipped your toe a little bit in the fashion industry,
Yes, sir.
going on. So I mean, yeah, tell us about the clothing brand you launched. What's going on with that?
So the clothing brand, I launched that halfway through my first year of grad school. And as I was going through the program, I realized I had 2 years left to graduate. And I knew that I needed something to keep me going, like in terms of the right now. Like I wanted to figure out how can I make an impact outside of what I do for a living. So I had zero knowledge of the clothing industry. Well, I know more now, but I didn't know too much about, how to run a clothing company. So I just went to Google. I Googled, my butt off, and I tried to contact people who knew more about that space. And then me and my friends came up with a clothing company, Bronte and Senior, which just essentially stands for gentleman and lady. And we use that to promote mental health awareness. And we got a partnership with Mental Health America, which is the largest nonprofit up in Washington, D.C., that serves people with mental health conditions. And as well, they also promote mental wellness for everybody. So being able to use something such as clothes to promote a message was pretty neat. And I chose clothes because, I figured out that, everybody wears clothes every day, and when I travel, I get a kick out of watching people. I'm at the airport, people send messages through their shirts. So I was looking for a way to convey a message without saying a single word. So, I gravitated towards the clothing business, and that's something that I think has been very gratifying for me, because even through that, random people have messaged me and said, you know what, I appreciate what you're doing. And it seems like a small thing to you, but like I'm actually benefiting a lot from the clothing company and your message and your purpose. So I thought that was pretty rewarding that, something as simple as a t-shirt or a hoodie or a sweatshirt can make such an impact on somebody.
Wow, so clearly you have a lot going on.
Right.
Author, fashion, and you're still with your main practice. So, like, what's next? Like, where do you see yourself in the next year, 5 years, 10 years? Like, where clearly you're an innovative person. Like, what's on your mind? Like, what are you trying to accomplish next?
Well, for me, like you said, I do consider myself to be an innovative person, and I just like to keep my mind clear. So, a lot of times, I feel like there's so much coming at you now with social media and your phones and distractions. So, any type of little distractions, or the little things that hit you on a day-to-day basis, I try and stay away from that, because I consider myself to be a visionary in a sense. So, like, I like to keep my mind open, and I just want options. I just want to keep my options as open as possible. I do a YouTube show where I talk about mental health awareness, and now it's start to shift towards talking about different professions within nursing, because I feel like that's where a lot of my questions are coming from. People wanting to know about different nursing professions, and then also talk about mental health awareness as well. So there's so many different avenues, and I'm not sure exactly what I'm going to do. I wouldn't mind hosting like a talk show. I wouldn't mind, uh, you know, maybe using my company and partnering up with somebody else, or I wouldn't mind, maybe putting out like a short film. I have thought about getting into the movie space, and the only thing that's holding me back is the fact that I don't know much about that industry. So it's just a matter of being patient, reaching out to somebody who knows about movies and things like that, and just learning from them. But like I have given serious thought. I'm into making like a movie or a short film, and I'm getting it to play into theater. So that's one kind of out of the way idea that I have. So I'll just sit on that for a little bit, and hopefully it comes to fruition.
Nah, like what so is amazing to me is that like you're doing all of these things like not only are you entering a space that normally doesn't have people that look like us, like you're going head on and you're like dominating it. So, speaking of like for example, like July is Minority Mental Health Month, like
Right.
what is your experience like? Like there's not a lot of people of color and there's not a lot of men that are really in the position that you're in.
Right.
Um, like what is your experience like being truly a minority in this field?
Yeah. It's fascinating because I come to work every day and I deal with people who obviously have mental health conditions, and even within that, within my environment, there's a lot of denial and people who do not want to be labeled as having, a mental health condition for fear of what they think that it means, because, as minorities, we're kind of raised to, shrug things off. And that's one of my quote unquote toxic traits where I didn't like talking about things, but working in this field, it's provided me with a lot of insight into just talking about things, if it bothers you, because, growing up, like we have to wear our toughness as a badge of honor. So if you're going through something, we don't talk about things and we're like, what, I'll be straight, I'm fine, I'm fine. But I've seen where I'm fine leads you to when you suppress feelings that are making you irritable and it's really bothering you deep down inside, it's not going to manifest as something that's beneficial or productive when it does come out of you. So I think just talking with the patients and educating them, and also letting people in my day to day know about the things that I know, because as minorities we don't talk about mental health, or we'll say things like let's promote mental health awareness. We'll say it, but I don't see the action behind those words. Because it's still the stigma is still there. It's still associated with being weak, or like if somebody's taking medication because they're hearing voices, like you're gonna stay far, far away from them because you're thinking, oh, this person is subhuman. They're not, as good as me. And nobody likes to talk about those things, but there's still that stigma, and there's still the belief that you can use things such as religion and just pray away diseases or conditions. So we have a long way to go. The conversation has been making some progress, but I feel like we still have a long way to go. We have to get very honest with ourselves because, we like to lie. And I mean, everybody does lie in a sense, but lying to yourself, I think, can be very destructive. So it's time to get self-aware and figure out the things that, within our, culture as African Americans, the things that we don't like to confront, like childhood trauma, people being molested in their childhood and their parents just kind of shrugging their shoulder and, just taking them to church. There's some very deep conversations that need to be had. And until we can get past those kind of things, we won't have any progress, unfortunately.
No, and again, you mentioned not only the culture side of it, but then also the religious side of it, and that's something that you've spoken about. But how how do you make the two worlds coexist? Of because so many people are like, give it to God, give it to God. Of course, you know
Right.
that's okay and stuff like that. But what we learn is that you also want to engage in the actual mental health practices. So how
Right.
do you make those two worlds coexist?
I just make them coexist by combining them. And I'm a believer, I consider myself to be a Bible believing Christian. So I do the best that I can do to do right by God. And, I try and go to church. I try and help people. And I try and lead by example. I know I'm not perfect. And I don't judge myself too much because, you can't be too hard on yourself. We're just doing the best that we can. But I try and combine the two by just combining them, just realizing that I can do devotion and then I can still talk about mental health awareness and things that are essential to the recovery of people who are going through mental health conditions, like therapy, talking about those things and letting people know that there's nothing wrong with going to therapy. And it seems like in the Black community, like we have kind of made like the pastor the all-in-one. Like he's your pastor, he's your therapist, he's your mental health counselor, he's your psychiatric provider. Like, the pastor might say, okay, well, don't take any medications, we can do this. And like you made the pastor this one big person who does everything. But I mean, that's clearly flawed, as we've seen that, you can have different people for different roles. You can have a pastor, and you can also have a medical professional who's helping you out. So trying to let people know that the two can coexist, but that you don't have to like combine them to the point where they start to like enmesh with each other. But you can have them too, like they can be separate but also together within the same space. So, but people don't associate the two. Like it's hard for people to think of mental health providers and then your pastor and religion like within the same space. Like it's always been made to where we have to pick one. So just understanding the fact that we don't have to pick one will be very helpful.
Definitely, definitely. And speaking more about kind of our backgrounds and upbringings and like I guess the different communities that we come from. Like you come from a very specific community that you mentioned in your book, and you didn't have all the resources growing up that maybe some other people have. Like, what impact do you think that has on people who grew up in similar communities? Like, what impact does it have on their mental health? Whether good or bad? A lot of times, I think part of that is you get like undiagnosed behaviors and whatnot. So, like, growing up the community that you grew up in, yeah, like what if there are any positive impacts, but also like the negative impacts did you experience, and do you see in others?
Yeah, I mean, of course, I feel like there's good and bad for everything. And me, I tend to lean towards the positive. I do have my moments where I'm like, dang, this sucks. And I try and snap out of it, and I try and think, more on the positive side of things. But I feel like in our culture, um, the the good thing is that we have, at least in the West African culture, because I'm from Ghana originally, we have the togetherness aspect down pretty well. We do things as family. So a lot of times, when you're going through something difficult and you have family support, nothing beats that. It's always good to have people that support you, an extended family system. And I feel like I've benefited from that. And my family's my world. And those 18 to 25 people within my space that mean the most to me, that keeps me going every day. But at the same time, I feel like, at least within my culture, being West African and also living in America for the majority of my life, I feel like boundaries is a huge, huge issue. We do not know how to set and keep boundaries. Like, there's so many blur lines with it, so many things, and it's difficult when like I said, with the pastor and the mental health thing. Like, the pastor is like within our society. He's like, you make this person kind of like God, where they can do no wrong, and then people start to worship the pastor, in a sense. And I feel like, being able to understand that you can have, a pastor and you can have a mental health counselor is one thing, but also at the same time, within our culture, as West Africans, we don't really have that entrepreneurial type of spirit. So me trying to do all these different things, a lot of times people look at me sideways, like, why are you doing this? Why don't you just stick to this? You can go work this good job from 9 to 5 and work another job like that. You don't have to write a book. You don't have to do a clothing company. So a lot of people are very closed-minded within our culture. And, the phrase, this is how it's always been done, is something that I keep hearing. So, but that's actually causing a lot of mental health issues for, the youth, because, we would always say things like, oh, this has always been done. So, for women, I feel like as guys, we have a little bit better, but for women, they have all these things that society puts on them, and especially within the West African culture, like marriage is a huge thing. So, like, I know people personally who've gotten married because they thought that was the right thing to do. And then, a few years later, they're unhappy, depressed, going through it because they felt like that's what culture demanded out of them. So when you go against the grain, in my culture, you're kind of seen as an outcast. So that's kind of how people have viewed me in a sense, until I started to have things that are tangible that you can see, like a book or, a personal brand. But it's very difficult to think for yourself when you're in that, minority or West African culture. So I think we have to have more conversations around making it okay to kind of do your own thing, because people are placed in a box, and that's causing anxiety. Anxiety is the most common mental health condition today, and it's been that way for as long as I can remember. And the um, the the pressure to be perfect is causing a lot of people anxiety. So just letting it be known that it's okay to do your own thing, um, that will save a lot of lives, I think.
Definitely. And again, you bring up another great point that I want to touch more on is anxiety. And that's something
Mhm.
that, you experienced and you've gone through. So yeah, can we talk more about like your in school experience and
Yeah, yeah,
how that
sure.
affected you as a student too? And like it really, you know, I would say affected your day to day. But yeah, do you want to give a couple more words on that?
For sure. The one of the psychiatrists who trained me when I was in school, he said that perfection leads to anxiety, touching more on what I just said. And I can relate with that because growing up, in the West African household, um, there wasn't much room for error. You kind of had to be perfect. You kind of had to follow suit, and you needed to go to school. You needed to get A's. You needed to make the family look good, and the family's reputation was more important than your own mental health or how you were doing. So whether you were a natural student or not, you're going to go to school and you're going to do this, and that's what you're going to do because that's how it's always been done. So growing up, there's a lot of pressure on me to make good grades, and I did fairly well until high school, and then it was F after F, and that was difficult for me because I'm thinking about college and what kind of career am I going to have one day. So I'm just sitting there, and I'm anxious about the fact that I know I have to go to college because I'm supposed to. I don't know what I'm going to do, but I have to figure something out. I have to do it fast. And for me, I actually work better under pressure. So like I got my stuff in order pretty quickly, but not everybody works as well in that scenario. So I feel like I'm fortunate, so I'm very thankful for the people that I did have that were able to, let me know that, it's going to be all right. You're a good student. You just have to put in more work. And that prevented me from taking the victim mentality and just blame things on people like, oh, it's unfair that I have this teacher who doesn't believe in me. And, my parents and my dad got laid off, blah, blah, blah. Because the more I dwell on that victim mentality mindset, I'm not going to make any progress. But I do want to push the conversation more towards letting people know that it's okay to fail, because it's those past failures which gave me the confidence to keep trying until I found something that I was successful at. And too often in our community, a lot of times you'll see people fail, and then instead of being focused on the actual child who's struggling, uh, you know, a lot of Africans I know would be focused on, oh, you failed, you're not going to go to this college, you're making the family look bad. Um, and in the meantime, your child is struggling. And that's how a lot of people, have anxiety that turns into depression, which turns into severe depression. People get hospitalized just like that. A lot of people have childhood trauma from situations that are similar to mine. So that's why I consider myself to be very fortunate. I was able to make it out. And now I feel like it's my responsibility to do things like what I'm doing now. And that's how I'm happy for this platform with you, this interview, to talk about these things. Maybe somebody who's going through what I went through is able to hear this and know that, they're still on the right track.
And did you feel that because you're coming from a family that's pretty successful, you had hardworking parents and whatnot, but you have brothers and sisters who were also in similar field. And I remember you even mentioned in your book you had younger siblings,
Siblings, yeah.
yeah, who you're saying to go to the same path. So just being in that, again, you come from a Western culture that's like family success matters so much. Was that a contributing factor to you being such a motivated person, or to your anxiety, or both? Like I imagine having such pressure to be successful because that's your culture. You're seeing it. You coming from parents who are like, I worked hard for this. Like I can imagine that kind of going both ways, kind of like what you just spoke about.
Right. No, yeah, I think it could have gone both ways. I definitely think that being raised up in that environment had a big part to do with a lot of the success that I've had. So I can't completely blame, the fact that I grew up in such a strict household with, such, lofty expectations. It actually turned out to benefit me. So I think that, I'm fortunate that I was in that environment. I do think that innately within me, there's some extra DNA that is more geared towards being a motivated person. Because even within my family, their goal, like their big thing is to, obviously not having a lot growing up, the goal is to provide. So any way you can provide, that's like the first goal. And then the second goal is to be in a field where, you can provide for not only yourself, but the generations after you. So once you get to that point, so I guess at this level where I'm at, being a doctorally prepared nurse practitioner, once you get to this point, that's where you've kind of made it. So that's where you can kind of sit back and kind of enjoy. And that seems to be kind of consistent through my whole family and extended family. But for me, internally, I kind of take it a step further. I see all these opportunities out here. I see how the internet is making things, just explode. There's so many different things, so many different avenues, and I just don't want to be in a box. So I said that would be the thing that differentiates me from my family. They're all fairly successful within what they do, but for me, I see so much that I want to get into, and I'm just not satisfied with staying here. I want to. I feel like I can make such a great impact if I get uncomfortable and I go into these different spaces where I don't necessarily belong, and just go and disrupt them in a positive way.
Definitely. And so anxiety and pressure is one thing that you've dealt with, but you've also dealt with bullying, and bullying is something that we've been working a lot with here at Flawless.
Right.
We work with Dr. Stuart Ablon from Think Kids in Massachusetts, and I mean from the route you took to school, being English as a second language group, and then what really hit me reading your book was what your teacher said to you.
Mm-hmm.
That you should go work at the gas station, and that's someone that took a job where they're supposed to be motivating
Right.
you. They're there's a lot that was putting you down through school, and I guess my two questions there is, one, how did you bounce back? Because that's something that could really destroy your confidence, number one. And then number two, as a professional, in the industry, what do you think we can do to stop this behavioral problem of bullying?
Well, I want to actually answer the second question first. I think that the things that we can do to stop is, first of all, you have to define what bullying is. Bullying is not just the bigger kid picking on the little kid. Bullying can be from your parents to you. It can be from you to your peers. It can be from your teachers to you. It's just anybody who uses their position to try and make somebody else feel small. And normally that's a reflection of them themselves. But that's bullying. It's rampant not only in schools but also in the hospital environment. I've seen different nurses bully other nurses. I see physicians bully younger physicians and residents. So this is just something that people feel like, oh, this is what has to be done. Is going to give you, tough skin and make you more resilient. But not see, people are structured in different ways. Not everybody responsible to that. So for me, hearing my gas station teacher say that, I was more like, all right, okay, cool. I have kind of a nonchalant personality, so sometimes I just kind of, let things roll off my shoulder. Sometimes they do come back to bother me, and I've learned that it is important to talk about it. But I've never been somebody that's been so expressive. I'm just kind of, nonchalant. And as I get older, I care less about the pains of the people around me, which I did talk about in the book, and that has given me an internal sense of peace. That knowing that nobody defines me outside of myself. But that was my journey. It took me, 25, 26, 27 years to get to that point where I'm fully secure in myself. And for a lot of adolescents, suicide is a huge problem, between the ages of 18 to 24. That's one of the biggest demographics where we lose a lot of people to suicide. So a lot of people could have been where I'm sitting right now, but maybe they were going through a tough time and they just couldn't get out of it. So it's important to talk about these things more and let people know that, bullying is not okay. There's other ways to get to people than, bullying them or bringing them down, because, people naturally will remember the negative, more than the positive. So we have to, just be more kind to each other. And the stuff that y'all are doing flawless with the bullying movements, the anti-bullying movement, I think is fantastic, because it lets people know that, we can create resilient people without bullying. I do know people that have been bullied, and they're successful because of that. But we have to understand that not everybody is, set up that way, and not everybody thrives in that environment. So for the same person that becomes successful off of it, somebody might take their own life because of it. So when, there's good and bad to everything, but when the bad is that bad, then it's time for an intervention.
Definitely, definitely. And then so appreciate your words on that, definitely. But to transition to a lighter note, we definitely shared another connection. And I was pleasantly surprised to see that you went to Kid Cudi during some tough times, and that album in particular, like
Yeah.
just listening to the other day, and I read that part of your book, and I was like, whoa, like that's wild. Like, and I think the thing there is for one, I want to say, why do you think that music in particular speaks to people? Well, I'll let you answer that question first, and then I will follow up question.
Okay. Yeah, so I'm a huge Kid Cudi fan. And obviously back in high school when I was listening to Kid Cudi, I didn't know that, I didn't connect it with like being depressed or like going through a tough time or being anxious, because, mental health awareness wasn't something that we spoke about a lot in 2008, 2009. So I was just like, I'm just going through it right now. I'm just, having a rough time, and I'm going to bounce back. But that music did a lot for me. And like, when the older I get and the more I read comments on like Kid Cudi's YouTube page, like, and I mean, for anybody who's watching this, like, just type in Kid Cudi, soundtrack to my life, go on YouTube, and then just read the comments. Like, people leaving comments such as, I was gonna take my life last week, and I listened to this, and I was like, whoa, this is big. Like, it was just enjoyable music to me, growing up in high school, and I listened to all kinds of different genres, but that music seemed to kind of like lift my spirits. And what it was doing for me was, it was doing what therapy would have done for me. First of all, we didn't have insurance growing up, the majority of when I was growing up. So a therapist would have been out of the question. Second of all, if I could have afforded a therapist, would I have gone to one? Would I have thought that it's corny or cheesy? I'm not sure. But, having somebody like Kid Cudi who, being a impressionable teenager, somebody who, like, he speaks our language, so he's connecting to us in a way that a professional can't, and he's put it in a form that is like very consumable for us. Like, he's put it in the album. You'll just play it while you're in your room. You'll just play it while you're playing basketball or whatever. So he got the message out in a very effective way.
Definitely. And then so I guess my second question is he's doing this on such a platform. Like, what do you see the benefits? Because recently, like this past year, we worked with a lot of different celebrities, a lot of different athletes too. But like, what does that say when somebody on such a high platform that to a lot of people become idolized and on top of the world? What does that say when they open up about their struggles with mental health? Like, how beneficial is that, do you think?
I think it's very beneficial. Sometimes it's not always positive, because, somebody who has a platform such as Kid Cudi, or any celebrity, they can say something and people will listen to it, because, people will listen to their favorite artist more than a healthcare professional. And I mean, even in one Kid Cudi song I could think off the top of my head, I think the song is "Just What I Am." Kid Cudi has a line there where he's like, I diagnosed my damn self. These damn pills ain't working, fam. And it's kind of like, as a healthcare professional, I understand it, because I have a lot of patients who are like, I'm not going to take these pills. But something such as like stopping your antidepressants or stopping your psychiatric medication can cause a lot of issues. But I mean, now that's his opinion. But overall, in the grand scheme of things, like, I'm thankful. I'm extremely thankful for someone like Kid Cudi, because he's done so much more good than bad by just initiating a conversation. So hearing celebrities like Kid Cudi or even Kanye West, he has a very big platform, and he talks about being bipolar. And I know Susie Favor Hamilton, she's an Olympian. she talks about being bipolar as well. So, people will not, um, even though we're about to be in 2020, people are just not going to listen to healthcare professionals over a celebrity. You don't idolize your favorite nurse practitioner or doctor. They're just there to help you. People idolize the Kardashians. They idolize Kid Cudi. They can see themselves, being a rapper and being on stage. So that's who they gravitate towards. So I feel like when a celebrity speaks on something, that's powerful. And a lot of celebrities are very aware of the fact that, people like Michelle Williams talking about depression, they're aware of the fact that, whether they like it or not, they have the platform to change the way the youth feels about almost everything. I remember Charles Barkley back in the day said that, as a basketball player, he shouldn't be a role model to people's children. He just plays basketball. And that was like in the early 90s, maybe 92, 93. But now we're sitting here almost 30 years later, and people are realizing that a celebrity means a lot to the everyday person. So like the words that they say really, really, really carry weight. So just anybody who has a platform who's talking about mental health awareness is much more powerful than they know.
Definitely. And then, so you mentioned Charles Barkley, and this past year we've worked with, been events with Ron Artest, Kevin Love, Adam Silver, Brandon Marshall. There was a piece recently from DeMar DeRozan. Uh,
Mhm.
all around, sports too seem to be picking up that wave of mental health, similar to how a lot of musicians have. And like, what have you seen from that you like, and like, what do you think we need more of in terms of the combination of mental health and athletics?
Um, I love it. I love the mental health movement in sports. Seeing people like Kevin Love open up about panic attacks, DeMar DeRozan talking about depression is very important because people will equate being a multimillionaire to being happy. So when DeMar DeRozan, like, he'll randomly delete Instagram posts, or he'll be talking about mental health awareness, and people won't understand. People will say, "Oh, if I had $20 million every year coming in, I would be happy." And it shows that people don't understand things such as depression. People don't understand anxiety and mental health conditions, and it's very important because just being an athlete, um, like that whole connection between mental health and sports, I'm very interested in it. And you had asked where do you see yourself in a few years. I can see myself in that space because I feel like people don't understand the pressures of a high profile athlete. Somebody like Brett Favre, when he was playing football, you're playing in front of 50, 60,000 fans every Sunday. The man couldn't retire. The high that you get off of people screaming your name and you scoring touchdowns is not going to be matched by anything that you do post-retirement. So for a lot of celebrities and athletes, once their platform is over, people don't care about them as much. They move on to the next big thing. So that's a huge, huge adjustment. So going from that high to, being where the everyday person is, that's a huge life transition. And not every athlete is able to, handle that. And a lot of athletes, some of them mismanage their money. So you go from making millions and then now you're broke, but you have this high profile name. And a lot of these things can, go back to mental health awareness. How do you feel about yourself? How do you feel about, the world around you? So I think just like that's a whole industry in of itself. Because even when I played high school football for a year, I remember the way that the coaches would be on the students, like the student athletes. Like there was no, talking about your feelings or mental health awareness was seen as like being weak. And when you're playing football, like you have to be ready to go to war. So it was difficult for mental health awareness or therapy to coexist with being a professional athlete. So I love the movement that we're headed towards. And I think it's going to help out a lot of people, a lot of athletes, because they feel the pressure of being a celebrity, but they don't know who to go to when they're going through a hard time. And there's also that stigma within like being a professional athlete and having to deal with that pressure and the anxiety. And I think somebody who could be a great ambassador for the movement, just randomly, I think it would be LeBron James. Like the scrutiny that he's faced as an athlete, I don't think any athlete in the history of sports, to my knowledge, has faced that type of scrutiny, from him being 18 years old to now being 35. 17 years in the league, the decision to go to Miami, and people constantly in his face, posting a random picture of his family or, a dog online, and people leaving death threats. That's not normal for any human being. So for him, having gone through that for so many years, like a lot of these athletes, when it's all said and done, they can really get into that mental health space and really make a huge difference.
Definitely. So, super excited to hear that that's something you're interested in. Currently at Flawless, we're actually working on a little project ourselves, and one aspect of it that we're kind of really diving into is how kind of everything that you said is like how athletes retire, and like I'm this guy or that guy, I'm on top of the world, but now I'm just a normal person. We're kind of focusing on that with collegiate and high school athletes. So just any advice you have for that like identity shifting moment where your career ends, whether it's your last high school game, whether it's your last collegiate game, where you're no longer that identity you've been for, 5, 10, 15 years of your life. What would you say to those student athletes who are now just students and that shift in their life? Like, what advice would you have for them? Because a lot of people really struggle.
Well, the first phrase that comes to mind is actually I think it's from a Biggie song. It might be Biggie, but is to not get too high off your own supply. So like you cannot let people define who you are, because they'll love you one moment and they hate you the next, and you can go from being hero to zero overnight. And it's difficult though, because if you're somebody who the general public loves, and as athletes, we idolize athletes, and we let the people that we love get away with so much, in their personal life, because we're like, oh, this person is scoring touchdowns for us on Sundays, or they continue to, score in the basketball court, or they keep hitting home runs, so it's very difficult as an athlete. And I empathize with them, because when you're at the top, nobody's going to really check you. Nobody's going to tell you what you need to hear, for fear of losing the benefits that come with being associated with this superstar athlete. So the most important thing I can say for these athletes is to try and remember, who you were before the fame, and keep that consistent. Just never forget who you are, and never forget where you came from, and just be humble. Understand that what you have today, it could go tomorrow. Random things happen. People get injured, especially in football. You can get hit on one play and your career is over. So it's always good to be humble, and just, also it's good to have your identity rooted in something outside of what you do for a living. And even me as a healthcare professional, like I still, want to be remembered as being a good person, somebody who was, true to themselves and the people around them. But for athletes, it's very difficult, because you can be somebody, we have to keep working on ourselves regardless. Every day, we evolve, we get better. But when you're somebody who people will love regardless, sometimes you take shortcuts and you don't want to work on the person that you are, because you feel like people will let you slide regardless. But when it all comes to an end and you have to deal with the person in the mirror, it can be very difficult. But hearing about these ex-athletes talking about their past issues, and there's so many podcasts and YouTube videos that we can watch nowadays, it's definitely making it a little bit easier for these athletes to just root their identity in something outside of what they do for a living.
Awesome. But Kojo, you dropped a lot of gems,
Sure.
minutes, but I have one last question for you. And I just want to know, what does the ideal and flawless world look like to you?
Ideal and flawless world. That's a great question. Because I know that we do not live in a perfect world, the ideal and flawless world to me is a world where people can be their most authentic selves at all times. Because I know that, we don't live in a perfect, utopian society where everything can be perfect. But I feel like you can be flawless, without flaw, as long as you are your most authentic self. So if you're, your most authentic self, and you're trying to be true to you, yourself and the people around you, even if you do mess up, your intent is still good. And that way you don't have the pressure of trying to be perfect. As long as you do the best that you can, and like I say, stay true to yourself, and I feel like you can be flawless in your own way.
Great. So, first things first, I want to thank you for finding the time to do this.
Thank you for having me.
Yeah, I mean, I like this is gonna be a help for a lot of people. It's helpful for me as someone that wants to kind of walk a similar path as you. Second thing I want to do is make sure that I again shout out your book you've already won.
Yes, sir.
Definitely want to get that out there. And then, yeah, you're doing a lot. Is there anything else, any social medias that you want people to know about, that you want to shout out, so people can connect with you and get closer to you and learn more about you?
Yeah, Instagram is kind of like the place where I'm at on the most. So Instagram.com / Ksarfo Live. That's KSARFO Live. That's the ad name. That's the same ad name on Twitter and Facebook as well. And another thing that I'm actually starting to do more of is TikTok. TikTok has about, I think, maybe 500 million active users. It's the fastest growing social network at the current moment. So TikTok, I thought it was more of like a kiddie thing, and I kept seeing like 13-year-olds on there, but now it's kind of segueing for like all kinds of people, medical professionals, athletes, and that's a great way to put out, different motivational messages and funny stuff as well, because we all need like a break. So TikTok is something that I'm real big on. In 2020, I plan to post a lot on TikTok. So TikTok is at Kojo Sarfo. That's a great place to follow me at as well.
Awesome, awesome. So we are finishing up with the Dr. Kojo Sarfo. Again, Kojo, thank you so much for giving us the time, and I can't wait to see what else is coming down the pipeline in the future.
Yes, sir. Thank you so much for having me. I really do appreciate it.
Definitely, man. Have a good day.